everyone. Welcome and thank you so much for joining us for the final session. Can you believe it? The final session of the Canada Health Infoway Partnership Series. I'm Suhana Marchand. Now, we do have attendees participating from across Canada and around the globe, and I'd like to take these opening moments together to acknowledge that the lands on which we are hosting this event include the traditional territories of many nations. Canada Health Infoway recognizes that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and continue to affect their well-being. Canada Health Infoway respects that Indigenous people have rich cultural and traditional practices that have been known to improve health outcomes. So I invite all attendees to reflect on the territories you are calling in from as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. As a journalist, I cover national and international news and healthcare. That is always a key topic, so I'm thrilled to be your MC today as we focus on prescribing excellence. I do have just a few points to cover before I introduce our first session. I know you're excited to get underway, but just bear with me for a moment. We do have simultaneous interpretation available for all Infoway Partnership Series sessions. So if you would like to listen to this session in French, please follow the instructions on the screen right now. We also have closed captioning services available. So to enable English closed captioning, simply select that CC button at the bottom right of your video player. The Virtual Infoway Partnership Series is very proud to be patients included. Infoway is pleased to continue to convene events which adhere to the accreditation. So in collaboration with its patient partners, Infoway has developed the Patient Family Caregiver Recognition and Inclusion Statement. And this statement acknowledges the critical role of patients, families, and caregivers and underscores the commitment to collaborate with them and work toward improving our health system. So here's the statement as it reads. We recognize the unwavering commitment and essential impact patients, families, and caregivers have and will always have on the Canadian healthcare system. Canada Health Infoway pledges to continuously listen to the perspectives and learn from the lived experiences of patients, families, and caregivers to ensure respectful collaboration in the work we do and influence. We look forward to building true partnerships and acknowledging shared successes. The patient advisor for this October 19th partnership series is, and you can see her there on your screen, Lynn Cooper. Lynn has been an advisor for the overall program development. So Lynn, a sincere thank you from the team at Canada Health Infoway for all of your hard work and all of your support, and welcome to this session. I'd also invite you to check out the polls and to share your experiences. You can find live polls on the right-hand side of the main stage video stream. Now, we have planned to allow for questions at the conclusion of each of the presentations. That is, should time permit. So please submit questions throughout the program via that Q&A box under the main stage video stream. At the conclusion of today's broadcast, we'd really appreciate it if you would share your event feedback. And you can find the survey at the right-hand side of your screen. And that really helps to make, further partnership series when they happen, to make them better and to be more sort of, towards what you would like to hear and learn about and engage in. And we would welcome you as well to engage with your fellow attendees in the platform chat. You can find the chat by clicking that little blue talk bubble icon. It's at the bottom right-hand corner of the screen. And the chat can be used in a couple of ways. You can share your comments with all of the attendees, which is great, or you can message specific attendees directly. So why don't we get on with the program? Yes, I agree. We'll kick off with a Canada Health Infoway welcome and update by Jamie Bruce. Jamie is Executive Vice President of Prescribe IT at Infoway. So please welcome me in please join me rather in welcoming Jamie to the virtual stage. Jamie, over to you.
Thank you, Suhan, and thank you everybody for attending today. As I worked across the country, we've heard loud and clear from our partners, patients, and constituents that health equity has been a top priority across Canada. We've also heard loud and clear that an effective virtual healthcare system is key to achieving this health equity. Digital medication is a fundamental component of virtual care, and it's a fundamental component of supporting safe patient care across millions and millions of transactions that occur through any given day, week, or month of the year. Our role to prescribe it has been to really build and expand a digital medication platform that's built to enable and connect into a national virtual healthcare ecosystem. As part of Infoway's strategic plan over the last 4 years, the Prescribe It team has been working diligently on developing a pan-Canadian electronic prescribing service. To do this effectively, we've been working with Canada's largest technology players and jurisdictions to integrate and connect virtual care and data solutions across the nation to provide a safe and effective service. Over the last 18 months, the reality of COVID have really illustrated the need for greater digital health offerings. Certainly across the board, we saw patients and physicians conducting care outside of the traditional confines of the office. Research conducted in conjunction of the Canadian Medical Association found that almost 2/3 of physicians would like to increase or maintain the use of virtual care after the pandemic. That's a pretty spectacular number when you think about the work on the front lines that these physicians have had to invest over the last 18 months. They're essentially saying that virtual tools and digital tools are helping them do their job better and improving patient care. And certainly on the patient side, we see the same thing. Almost 2/3 of patients want virtual visits for prescription renewals. This requires not only an effective virtual care system, but effective digital medication system as well. Today, you're going to hear from presentations from physicians, patients, and hospital executives. They're each going to have their own unique perspective on how digital health and e-prescribing in particular is an important form of delivery. These stories are not just anecdotes anymore. These stories are ones we hear all the time and the reasons that we really strive. Before we get to those presentations, I would like to share with you some highlights from the business and from digital medication from the last few months. Certainly, the activity has swelled over the last 18 months. COVID has really demonstrated how important virtual and digital care is within the ecosystem. Navigations, clinicians navigating, jurisdictions navigating, patients navigating. Certainly, we saw a lot of demand across the country for these types of services. And so we had to do a lot more work. We've made great strides. We forged ahead, and we really ensured that we created partnerships that were effective, partnerships that were going to allow us to not only have a service that was important, but also scalable. We worked hard to enroll EMR vendors, pharmacy management system vendors across the country. And we're proud to say that we have the majority of vendors working with us today and other ones getting ready to join us soon. We've also been increasing the number of prescribers and retail pharmacies. Prescriber participation has never been larger, and our footprint continues to grow across the country. We've been working with jurisdictions, and we have MOUs with every single jurisdiction in Canada. Of those, we've also been asking the Canadian population, what are the priorities for digital medication over the next 5 years or 10 years? What do you need to see? What's important to you? And for the first time ever, we've consolidated a national list of policies and priorities for digital medication, which we will be unveiling later on this fall. Another very important concept is around product excellence. And as you well know, if the product is not seamless and usable, then it falls by the wayside. And we've invested heavily to design workflows that are effective for physicians, workflows that are effective for pharmacists, but most importantly, workflows that are really going to help drive patient communication. And that patient communication part is critical to patient care and patient safety. We're investing in best practices, education, and courses for vendors, physicians, and pharmacists. And we're providing funds for our partners to integrate the newest specifications and improve workflows. Our Workflow Excellence program is implementing customer-driven workflow improvements, including multiple prescription handling. Our enhanced EMR program is encouraging adoption and meaningful use at the customer level, ensuring that physicians just don't have the tool, but they actually have the resources to learn how to use it effectively. And we've also been very excited this year to launch a new initiative in the hospital space. We recognize that to have a very effective digital medication platform across Canada, that hospitals need to be part of the solution. And so we're actively piloting the approach of e-prescribing within a hospital environment with plans to roll it across the country. Now, achieving this vision is really a shared success. It's not easy to do without really strong partners. And our priority is really about following best service guidelines and creating an improved product each and every day for our users to make sure the value is there. We've implemented a number of governance structures that have us listening and learning from our stakeholders. And the governance structures are not just about stakeholders in the community who are providing care, but also patients as well. As mentioned earlier, you're going to hear a little bit around the patient stories and the patient impact, and that's what really excites us. I'm going to turn it back over to our host, Suhana, and our invited guest, who will share some perspectives with you, unless there's any last questions.
Before I let you go, I am going to ask you some questions, Jamie. And by the way, congratulations with trying to get into hospitals. I want to know how excited hospitals are about Prescribe It, and whether, what the biggest challenges might be in that venue.
Certainly, one of the biggest inputs we had over the last year is that physicians were excited to use the service, but they also know that when patients come from the hospital back to the community, sometimes there's a break in continuity of care. Mm-hmm. And in most circumstances, that involves medication. And that can be extremely dangerous if there's not the proper communication between the hospitals and the communities. So we've seen excitement on both sides. And we were very happy that during COVID, we actually had a lot of inbound requests about how quickly can we get this up and running to connect better into communities and vice versa. And that stimulated us to push harder to figure out how do we get the solution to connect those two important parts of the community care system. And so that, we believe, is going to be a really big initiative in 2022 as well, building on some of our successes this year.
And speaking of building on successes, you mentioned COVID, and that has really changed so much of, what we do, what we expect out of healthcare, how we use our physicians' time, et cetera. And if anything, that last 19 months, as you say, has really accelerated the need for virtual care and services like Prescribe It. So how do you ensure that this pace, this culture of change actually continues?
Yeah, it's a great question. And our biggest enemy is really complacency. Everybody's been very busy. It's been a tremendous strain on the system for the last 18 months. But we have to remember we've also made some tremendous gains as well. We have an opportunity to create a generational change in how we think about patient care in Canada. And it requires us to be leaning forward into that and not leaning back. And so my ask for us as an organization, for all of our partners, is let's lean into that and remember that at the end, it's about patient care, and we have an opportunity to really impact that going forward.
Thanks for that, Jamie. That's Jamie Bruce, Executive VP of Prescribe It at Infoway. And Jamie, you mentioned that we're going to hear from patients. So why don't we get to that right now as we continue with our program? A patient's perspective on why excellence in e-prescribing really matters. So please welcome Lynn Cooper to the virtual stage. Hello to you, Lynn.
Well, good afternoon. It's wonderful to be here.
Can't wait to hear your story. What is it for you that really makes this so important?
Well, it's really important that we get our patient care effective, efficient, and sensitized to the needs of patients. And so in my talk, I'm going to be exploring some of the challenges that we can have and some of the ways that an e-prescribing system like Prescribe It can really make a difference for our healthcare. And so,
all right, let's get to your presentation.
I'm excited to get going. Mena, we can go to the next slide. I'm thrilled to be part of the presentation team today, and my role here is to talk about how important excellence in e-prescribing can be in the lives, in the quality of life of people, in helping us to manage our health conditions. You know, there are lots of times, especially with acute situations that come up in our lives, that all of us need to get a prescription. And usually when that happens, we're not feeling well. And it would be so wonderful to be able to have a system that can support us in getting that prescription as fast as we can, and to be using that prescription with confidence. And so my lens we'll just go back there a little bit to the previous slide there, Mena. My lens on presenting today has me wearing two hats. The first one is that I'm like everybody here who's been a caregiver, a patient themselves, or a family member who's helped to get a prescription. The second is that I'm an educator and an advocate in the Canadian pain community, where we look to make improvements in pain care, and that can include how medications are prescribed for chronic pain. One of the focuses that is really important to me, has been for more than 20 years, is to make sure that the voice, the perspectives, the skills and the talents and the visions of people with lived experience are included in everything about our healthcare, in policy discussions, in research, and making sure that we're making good changes in our systems. And so what brought me to the pain world was that I was an injured worker who developed persistent pain, and I had to find my way in a journey to live my best life in spite of the pain. Sometimes that included having a prescription. More importantly, it included learning and implementing coping strategies in my life that had a multidisciplinary nature. And that is the case for most people who live with pain. That's what we need to aspire to. So my involvement on the Prescribe It team has been working on the opioid working group. And that group is made up of very knowledgeable Prescribe It staff, prescribers, pharmacists, and me. And also we take samplings of input from lots of patients about their perspectives on the Prescribe It tool and what's important to them in their prescriptions. So Prescribe It, why did I join? Why did I volunteer? I choose my volunteering very carefully, and this situation really appealed to me because I could see the benefits for improving overall healthcare by implementing a pan-Canadian modernized prescribing system that would make things easier for patients. And why do I stay involved? That's because Prescribe It ensures that the people the stakeholders who are involved are included in a way that we can work collaboratively together to look at the challenges that face the existing prescription situation and what can benefit in an e-prescribing platform. And so we are continuing to work together. As late as last week, we had an hour-and-a-half meeting to make strategic changes to the e-prescribing platform for opioids. And so I'm just thrilled to be involved with all of that. And I know that we're creating a platform that's going to support our healthcare providers working together, specifically the pharmacists who need to be embedded more in our healthcare teams and our prescribers. When they are able to support one another, patients are better supported with their prescriptions. We can move to the next slide. It's important to think about patient safety and how e-prescribing can make a difference for us. Simplifying the prescription process means, and having it online means, there's no paper that can be misplaced, lost, or stolen. It can promote the use of one pharmacy where people are filling their prescriptions and where there's active communication between the prescriber and the pharmacy team at that one pharmacy. And within the pain world, this can be very helpful when you're looking at individuals who are receiving daily doses of medication that they need to help manage their pain. And not every pharmacy can deliver those doses every day. And sometimes, quite often, you need to have different pharmacies working together. And so an e-prescribe it system can help to keep track of where the dispensing is happening. Eliminating faxing. Who hasn't had an issue with wondering if the faxing system is working well? Has the fax been received? Has it been lost? And is your prescription filled? So faxing delays can really complicate a patient's life. And I visited my primary care physician last week, and I mentioned I was doing this presentation and that I would be speaking about e-prescribing and the importance of it. And what she wanted me to mention was how important e-prescribing is because faxing can create tremendous delays for the family health teams. And they often wonder whether or not the fax has truly been received and whether the prescription has been filled. So it really makes a difference that my family team uses e-prescribing. E-prescribing also can eliminate errors in transcribing. You know, when you take that piece of paper to your pharmacy team, you always hope that they're going to be able to read doctor's script. It's always a joke. You just kind of wonder if that's going to happen, but that is extremely important. E-prescribing promotes what I think is something so important, and that is effective communication between my prescriber and my pharmacist, especially if this is a new medication for me, where there needs to be considerations about drug interactions, compatibility, potential dose differences from a previous medication that I might be on. And so being able to support one another, and the pharmacist who has that in-depth knowledge of medications to be able to provide advice and support to the prescriber is very, very important to me. Prescribe It promotes evidence-based learning. There are prompts, certainly within the opioid prescribing system, that give up-to-date evidence so that my prescriber can make the best informed choice for me. And of course, the safety surrounding prescriptions is involved. When paper is not present, there cannot be stealing of that paper, and there cannot be fraud done with the prescription for illicit purposes. We'll move on to the next slide. And so the streamlining of the prescription process really can make a difference for us. Imagine getting your paper prescription, driving or taking it to the pharmacy, however you have to get there, possibly waiting in line to get to the window, then having a conversation with the pharmacist who maybe has to ask for clarification, and the pharmacist is asking, did your doctor say this? Did your doctor mean that? Oh, I'm going to need to speak with my doctor or your doctor. And then there could be a delay. So if you're lucky and the prescription just goes in, then you have the choice to wait for the prescription in a very busy pharmacy setting, or you leave and possibly have to make arrangements for someone to bring you back, or fit that into your busy schedule to come back to be able to pick up that prescription. And so there are transportation issues that can be involved, especially if you live in a rural setting where coming back could require hours of time. So with e-prescribing, you simply know that the prescription has gone through, and you go, you pick up your prescription, and if necessary, there would be more time for you to have a consult with the pharmacist about it. E-prescribing can support privacy. Imagine, again, being at that window and with your paper prescription and having the discussion that I just mentioned with all kinds of other people in the lineup behind you waiting to put their prescription in. And depending on what your prescription is for, you could be feeling very exposed and potentially embarrassed and wondering who is hearing what. There can be a tremendous amount of stigma and fear related to receiving prescriptions for chronic pain. They aren't always opioids, but there is a stigma about having chronic pain where there can be a lot of disbelief about that. And there can be stigma surrounding picking up prescriptions of opioids for either acute or chronic pain management. So you run the risk, again, of having people around you hear your conversation and having some trauma about that. And you may even go home and think twice about actually taking and filling the prescription that you might need. So we want to reduce the stigma. The important factor about my prescriber and my pharmacy team being able to talk about the nuances of my health condition and to be able to come up with all of the considerations when giving me a prescription is really important. It's also important to me that they're supporting one another and that they feel confident that when I pick up my prescription, I've got the best medication at the best dose for me. And so that gives me confidence in the system and confidence in my prescriber and my pharmacist. Next slide, please. So Jamie already spoke about a lot of the challenges that we have had because of COVID. And patients who were looking to get renewals of prescriptions and even get to a family physician and then be able to obtain a prescription for a new health issue. We had a lot of fears about how that was going to work when everything shut down. And so those challenges, especially when it came to opioids, which could not be called in by the prescriber, really created a lot of challenges for patients. However, the fact that Prescribe It was released just at this time really created a positive situation where we could start to move online for this type of health service. And I'm delighted to see that it is moving forward. I'm delighted to be part of it. We've got the opportunity now to create a pan-Canadian system, that is going to be patient-centered, that is going to promote better interaction between our prescriber, our pharmacist, and ourselves as patients, so that we can all make informed decisions. And I've really been impressed with how Prescribe It is approaching taking the basic system and exploring and inviting input from the affected stakeholders to let them know how we can improve the system and how we can address lots of nuances in prescribing and in the needs of the patients getting those prescriptions, so that the platform is going to improve with each and every time we meet, especially for the opioid prescribing. And I really would encourage Prescribe It to look at how we can integrate this e-prescribing system with existing app platforms at pharmacies, so that patients can track where their prescription is in the pipeline. There are so many more things that I could have talked about today. I'm almost out of time here, and so there might be a question for me. Thank you very much.
Here's a question, and I'd like to pose this to you. If you could, with all of the knowledge and the work that you have done with Prescribe It, with pharmacists, with providers, et cetera, what would you like to see if you could prioritize what should be focused on? What would one issue be that you would like to see at the top of that list for policymakers?
Well, for policymakers, I would like them to focus on making this e-prescribing pan-Canadian, that this is the future, and the future is now. I think that they should assist in letting patients know and letting the prescribers know that this program is available. There are, we know, some patients out there who would be very reticent to move from the paper prescription to e-prescribing. And so I really think that there will be some time needed and effort needed to hear their fears and their concerns, and to address those, and to provide education about how e-prescribing can take care of them better, especially if e-prescribing can be connected with EMRs.
Thanks for that, Lynn. And I can attest to the fact that I have made multiple trips to the pharmacy to pick up a prescription that was faxed, and then it wasn't faxed, and then you have to wait in line. You're absolutely right. So thank you for your presentation. That is Lynn Cooper. And we'll move right on to our next presenter. It is my pleasure to welcome Dr. Glenn Geiger, Chief Medical Information Officer at the Ottawa Hospital, to share the hospital's perspective around e-prescribing excellence. Dr. Geiger, welcome to you.
Thank you for having me. It's really great to be here, and it's nice to be following Lynn's speech. I'm going to be picking up on the same themes that she mentioned already, and I'm not sure. She said it so well, I'm not sure what I can add, but let me give it a try. So if you could bring up my slides, thank you. So I'm presenting on behalf of the hospital, specifically the Ottawa Hospital, our experience with prescription technology. I'm going to be providing an overview going from the past and working our way towards the present and the new initiatives that we have with Canada Health Infoway. So let me see if I can get this to work. There we go. So I'm going to be discussing our historical world. I think, as you can see from my photo, I'm not young anymore, so I'm certainly very familiar with the old world paper-based prescriptions that we used in the past. I can then tell you our experience and my experience with transitioning from sort of paper-based workflow to a more formal medication reconciliation-based workflow that we've been using at the Ottawa Hospital now for 8 years. And moving on to our current world of the technology layer that we're using today and the focus we've had on enhancing our prescription process. And then lastly, I'm going to be moving on to provide a perspective on e-prescribing and how we see it at the hospital. So going back to the old world of paper prescriptions, once again, this is what I'm very familiar with from the distant past. Perhaps it's the reality in many situations still today. But the workflow we had before, it's already been alluded to by Lynn and others, is a paper-based handwritten prescription would be provided to the patient, would then have to be physically moved to the pharmacy, where the pharmacist would decipher the handwriting and then provide the prescription. It's funny when I look back on it, nobody really gave the whole workflow a lot of thought. Many people commented on the illegible nature of the handwriting, and so there was a lot of conversation about that. But as I look back on it today, I'm surprised at some of the other risks associated with workflow that nobody really thought of at all. So handwriting they talked about, but nobody asked the question about drug and drug allergy interaction checking on a manual or handwritten based prescription. There was no automated way, so you're relying upon the physician at the initiation to have a thorough understanding of the patient's medications or allergies, and then the pharmacist subsequently to also have a strong idea and knowledge about the patient's other medications and the patient's allergies. Incomplete medication histories, both the physician at the physician's end as well as the pharmacist might not be fully aware of all the medications the patient was taking or is taking. So therefore, there's a risk of overlapping the therapies, different types of medications being administered by different physicians, perhaps dispensed at different pharmacies based on convenience, and therefore the risk the patient would have overlapping therapies. And there was no way to manage this, and nobody even talked about it. I never remember anybody really bringing up this issue. The issue of diversion of prescriptions and forgery or fraud associated with prescriptions wasn't really talked about very much, although people were obviously aware that it was happening. Lynn has already talked about the phone calls and faxes for clarifications and renewals of prescriptions, and the sort of manual basis of the communication between the person who originated the prescription and the pharmacy that was dispensing the prescription, with the patient sort of caught in between. And then discontinuation of medications wasn't really a workflow anybody thought about. In other words, in the manual or paper-based prescribing workflow, you just add one prescription on top of another, right? You're giving a prescription, but you're not undoing old prescriptions. In fact, nobody ever thought about it, right? Which, as I say, looking back on it, I find the whole thing kind of strange. Why did nobody even bring up the idea? Basically, what you'd say is you'd tell the patient, stop taking this medication, here's the prescription for the new one. And then you hoped that the patient would convey that information to the pharmacist, so the pharmacist would also be clear on which medications the patient was to continue and which ones they weren't. So this workflow, and it does still exist today, but it has a number of deficiencies in addition to the handwriting problem that's been alluded to. I'm going to talk about some incidents that we have from the past. We documented these incidents quite a number of years ago, before we moved to a slightly more modern workflow. Just so everyone on this conference knows, the contents of these incidents have been altered a little bit to protect patients' privacy, so take them a little bit with a grain of salt. They're not literally exactly what happened, but I do want to be respectful to patient privacy whenever I provide information of this kind. So the first example, a patient was admitted for surgery, and in the recovery room, the post-care team wrote a prescription for a modest dose, a dose of oxycodone to be given for the next period of time while the patient recovered in hospital, without really recognizing that prior to admission, the patient had been on a very significant dose of OxyContin in the community, and this discrepancy between the dose that was prescribed post-operatively and the dose the patient put on preoperatively was not recognized, resulting in the patient developing acute narcotic withdrawal because of the significant underdosing compared to the patient's habitual dosage of medication. So this is a result of manual paper-based processes and not having a comprehensive view of the patient's true medications and recognizing the distinction between the preoperative state and the postoperative care. In the second case here, a patient admitted with congestive heart failure and was prescribed a diuretic at home, and then when they were admitted to hospital, they were transitioned to an intravenous dose of the same diuretic to help relieve the fluid congestion. But when the patient was discharged home after an inpatient stay where they were managed for their heart failure, the prescription list at discharge did not include the diuretic therapy, and so the patient returned back to hospital, back in heart failure again, because the medication prescription on discharge had not been updated correctly to reflect the patient's ongoing need for active diuretic therapy. And a third example here, a patient is admitted and with a different condition, a heart attack, and then had previously been taking a dose of thyroid medication at 30 micrograms, but on discharge, a manual paper-based prescription was written, and the pharmacist read the prescription, and that is what the prescription looked like. It said a dose of 300 micrograms, which was 10 times the original dose. So the patient received an excessive dose of thyroid hormone medication and returned about a month later with thyrotoxicosis when we discovered this error had occurred. So these are examples of the consequences of, these are real cases, although as the details have been modified a little bit. But this is the nature of the paper-based world that we had before. In recognition of this, we decided to implement this about 8 years ago at our hospital. We implemented a workflow we call medication reconciliation. I'm sure some of you have heard of it, and some of you are probably practicing it. Medication reconciliation is a modified workflow where a team of clinicians, typically our pharmacists or pharmacy technicians, clarify the medication list by speaking to the patient, containing documentation for the patient, and contacting the patient's outpatient pharmacies so that they can confirm exactly which medications the patients are on, and then provide this information to the prescribing physicians in the emergency department or in the inpatient care settings. We tried this for a while. We tried this manually with paper forms and physical charts. And ultimately, at our hospital, we decided to move from a manual-based process to an electronic process by putting in place some computer technology to carry this information from the pharmacist to the physician to the dispensing workflow. This workflow still resulted in a paper prescription, but it was a computer-generated prescription. So the workflow allowed the discharging physician to use the information obtained from the best possible medication history, plus the inpatient therapies, to reconcile these medications and try to address overlapping medications or missed medications at the time of discharge. So as you can see, this workflow offers the opportunity to address drug-drug interactions and inaccurate medication histories. It starts to help us avoid issues of overlapping therapies, and the printed discharge prescriptions helped avoid the issue of illegible handwriting. The workflow did not address other issues such as diversion of prescriptions, because the output of the workflow was still paper. The clarification, phone calls, and renewals was still a manual process, and discontinuation of medications was not always effective in this workflow. So the biggest challenge we found and still find with this workflow is it's very labor intensive. It requires a lot of effort to keep this workflow functioning, and that's difficult to be done in a timely fashion. With our latest technology interventions, we've now managed to enhance this workflow. The basic mechanism of the workflow remains the same, but we've included auto faxing. So now we can transmit faxes directly from our inpatient environment to the patient's specific pharmacy. We've reformatted our prescriptions to include more detail, and I show pictures of that, of a prescription there. There's a prescription component and specific instructions of which medications to stop taking, which medications to continue taking, which medications to start, so they've been initiated during the hospital encounter. We added a digital signature to this workflow, so the prescribing physicians having a digital version of their signature, which gets attached to the formatted document when it's printed or auto-faxed to receiving pharmacy. And we have what we call a Verity stamp at the bottom of the prescription, which is a section of the prescription that has a message written in microprint. And it basically means that if you attempt to photocopy the prescription or duplicate the prescription, it can't be successfully photocopied because of this microprint at the bottom. So this is an attempt to address the issue of prescription diversion, and it attempts to be specific about medication discontinuation. It doesn't yet fully address the issue of clarifications, faxes, and communication from the dispensing pharmacy back to the prescriber. So that's our world as it is today. We have enhanced the medication reconciliation workflow, but a lot of the elements of the workflow remain what they were before. Oh, I'm not going forward here. There we go. Does this work perfectly? Once again, a slightly fictionalized account here of a patient who was with chronic kidney failure, who was experiencing a worsening in kidney function, was seen in the outpatient care area, and they were concerned about a medication that might be interfering with the patient's kidney function and wanted it to be discontinued. This discontinuation of medication did not get executed by the retail pharmacy because the communication was insufficiently clear. So the patient ended up on both medications. They were then admitted to the hospital and then dispensed both medications or prescribed both medications at discharge without the duplication being recognized. And it was only a month later that the duplication of the medications was identified. So this is the state that we're in today, where we've improved. We put a lot of effort into making the workflow better. We're still not able to fully address the kind of concerns that we have in the complex world of prescribing. So where do we want to go? The new world, as you've already heard, is e-prescribing. And basically what my illustration here shows is a communication channel between the physician, the patient, and the pharmacist that allows two-way, continuous, up-to-date, accurate information to be shared among the three stakeholders involved. And this is the workflow we really wish to achieve. A comprehensive and complete patient medication profile, move away from manual patient medication reconciliation that we do today. It won't go away tomorrow, but the hope is that we'll gradually be able to have accurate information available at all times, and therefore the manual workflow of medication reconciliation will be less needed than before. Transition to direct two-way communication between the prescribers and dispensing pharmacist. And once again, Lynn alluded to that earlier. We want clear communication of meds to be started, meds to be stopped, meds to be continued. We want rapid clarification and renewal of prescriptions when necessary, and the pharmacist to be able to communicate with the provider and vice versa. We want, of course, to eliminate faxes, and that was alluded to at the top of this conference meeting about the role of faxes and the inadequacy of this technology to address the importance of medications. And we'd like to reduce the need for ancillary phone calls, but once again, create a communication channel between the prescriber and the dispensing pharmacist, as well as include the patient in this environment, so that everybody is on the same page and knows exactly what it is we're trying to do with the patient's medications, and has an accurate and up-to-date view of what's being prescribed and recommended for the patient. So that's our vision of where we'd like to go. I think it's consistent with what you've heard from the other speakers, and that's certainly the pilot we're getting ready to initiate between Canada Health Infoway and the Ottawa Hospital. And I think I have a couple minutes for questions.
Dr. Geiger, I'm sort of aghast at some of the problems you pointed out in the old way. And, you know, it leaves me knowing that there is a better way. In the scenario that you presented with prescribers and pharmacists having a communication channel, I'm just wondering, you know, you can lead a horse to water, but you can't force the horse to drink. Is that communication channel being used to the best of its ability?
Well, we are still in the process of setting that up, and that's exactly where advocacy, this meeting, and others like yourself have to be involved, right? And Lynn alluded to this, right? Is we need people to get everyone to understand what I just presented and others presented about how the old workflow really isn't that effective. It has problems. Once again, people don't notice. The handwriting, everyone notices, but the other issues people don't seem to be aware of. So communication by yourself, by political leaders at Canada Health Infoway and others to make everybody realize this is a better, safer, more efficient, more effective workflow. We should transition to using this workflow as far as possible across the entire country. Once again, as Lynn said, we need to move there. It may not seem as important as some other issues that we're facing today, perhaps, but it does cause problems.
We know we're in an opioid crisis. That word has been used by activists, by politicians, et cetera. When you talk about, you know, forgery in the old world, if you will, how much do you think this will stop that to help ease that opioid crisis in which we find ourselves?
Well, I don't want to go on a long digression about that. I speak about that with my students a lot. But what I would say is patients need correct, accurate dosing of their medications, particularly in chronic pain situations, but even acute pain situations. It's very, very important they receive the correct prescription, that they don't receive multiple mistaken prescriptions where they overlap, where two different providers have both prescribed something and the patient may be unaware. The names are sometimes not clear. And so the patients can experience overlapping medications, but at the same time, we don't want the patient to miss out on medications. And so having a communication channel with up-to-date medication information is going to ensure the patients receive their medications correctly in a timely fashion.
Dr. Geiger, great to have you on this series, and I look forward to more information on how that pilot project goes, and what it is that is so exciting about it, and the benchmarks that you hit with that project as well. So thank you for your time. Great to have you on with us today.
Thank you so much.
So that was Dr. Geiger there. Now to our final presenter of the day. It is my pleasure to welcome Dr. Rashed Bayat, clinician leader at Infoway. And Dr. Bayat will be sharing his perspective around why e-prescribing excellence matters. And that's, that's a big part of this. This theme is about excellence in e-prescribing. So over to you, Dr. Bayat.
Hi, and good afternoon, and thank you, Suhana. Hi, everyone. My name is Rashed Bayat. I'm a family physician with a passion for digital health and physician leader working part-time with Canada Health Infoway. Over the years, I've had the great fortune to work in a mixture of urban and rural practices in 3 provinces, as well as working as a hospitalist. And I currently practice in Brampton, Ontario, in the northwest end of the Greater Toronto area. I want to thank the partnership conference organizers and all attendees for allowing me the opportunity to speak with you today about excellence in electronic prescribing. So you may hear some familiar themes in this talk, echoing some of what Lynn and Dr. Geiger have touched upon. So I won't spend a lot of time on this slide, but for those of you who are not familiar with us, Canada Health Infoway is an independent, not-for-profit organization federally funded through Health Canada. So we've been accelerating the effective use of digital health solutions across Canada since 2001. Infoway and our role have been evolving over time, and we continue to evolve to meet the needs of Canadians. But the story of Infoway mirrors the evolution of digital and provides critical context to understand why we didn't have e-prescribing earlier. So we started out as this strategic investor in the building blocks or foundational elements of each province's or territory's electronic health record system. Around 2010, we began to fund digital tools for clinicians, primarily through an investment program in electronic medical records for primary care and supporting the critical change management tool of clinician peer networks. Doctors helping doctors adopt EMRs. Keep in mind that in 2007, EMR adoption by family physicians was only 24%, and by 2010, this was still only 41%. However, the figure had increased to 86% by 2019 and is even higher today, as we'll see. Around 2016, 2017, as you can see in the slide, Infoway received direction from Health Canada to take on a role as a service and solution provider. And around the same time, Infoway received this dedicated funding to kickstart the national e-prescribing solution now known as Prescribing. In March 2020, Infoway was called upon to rapidly pivot to what the provinces and territories needed at the onset of the COVID-19 crisis, reallocated funding for specific virtual care services. So the point of showing you all of this and some of the following slides is to establish context. E-prescribing is long overdue in Canada, but all the pieces of the puzzle had not yet been in place in order to set it up for success. And this includes not only digital infrastructure, but also the massive cultural change and shift in attitude towards digital technologies in healthcare. In the past decade, physicians have only just been getting used to leaving paper prescription pads for EMR-based prescribing. Many only started using EMR-based prescribing quite recently. Change takes time. Sorry, I'm just trying to advance the slide here. Okay, perfect. So Infoway recently partnered with the Canadian Medical Association on the 2021 National Survey of Canadian Physicians with the goal of learning about current use and perceptions of and their experience with virtual care, challenges and barriers to use, and anticipated future use of virtual care post-pandemic. The sample was a reasonable size, involving over 2,000 physicians practicing in Canada. And the next few slides address some of the findings and again set the context for e-prescribing and aspiring to modernize the prescribing process in this country. Okay, so I'll just make sure that we have this. Oops, go back one slide, apologies. So you can see some of the key findings on this slide. Overall, they speak towards a rapid pivot out of necessity to virtual care during the pandemic, but also towards a normalization of virtual care. There is a high use of virtual care overall. As you can see, it's heavily weighted towards telephone, but with 51% using video, 36% email and messaging, secure messaging. 84% say that virtual care improves patient access to care, and 7 in 10 respondents say that virtual care enables quality and efficient care for patients. So the normalization comment that I made is an important aspect of change. Suddenly, a concept like e-prescribing, a digital tool that supports virtual care and remotely delivered care, goes from being a foreign concept to a no-brainer. And we'll just flip to the next slide here. So this is a good news slide. You saw a foreshadowing of it on the previous slide. EMR use really has increased across all physicians to 87% and 93% for family physicians in 2021. So this increased from 86% of family docs in 2019. Again, if we look at this from a 30,000-foot view, without this established base of EMR, electronic medical record use, how could physicians aspire to true electronic prescribing in an easy way? So I won't dwell too much on this slide, but over 9 in 10 physicians provided virtual care at the time of the survey, again with telephone being favored, heavily favored, followed by video visits. And you can see the change over 2020 in this slide. So when we head into our time machine and we examine these keys to sustaining virtual care from a presentation that I made about a year ago, they haven't really changed a whole lot. Some progress has been made in all of these domains, albeit incrementally. From the e-prescribing or prescribe it perspective, I would like to highlight this third point, change management and supporting physicians' use of modern tools. We need to remember the quadruple aim and seek to improve the provider experience, particularly with digital tools. Let's make it easy for clinicians to do the right thing with digital and virtual care tools. So since the onset of the COVID-19 pandemic, virtual care has been normalized for patients and for many clinicians. We've gotten used to it, as uncomfortable as it might be. But paraphrasing Dr. Julia Adler-Milstein from her 2021 JAMA article, digitization is not digital transformation. So simply using digital tools without actually putting in appropriate system-level supports may just move the problems of the paper world into the digital world. And if you look towards that hybrid state, that so-called hybrid state, a mix of virtual and in-person care that was predicted last year by myself and many others, it's uncertain and it has numerous dependencies. Plus, there are numerous challenges ahead. I'll just name a few on this slide: the digital divide, and the one that I will focus on in the context of electronic prescribing, physician burnout. We knew before the pandemic, primarily from US data, that digital health tools were implicated in physician burnout. And if we look at Canadian data from a recent OMA, Ontario Medical Association survey, it indicates that almost 73% of physicians are experiencing some form of burnout in 2021. And the OMA recommends solutions that directly identify electronic and digital tools as a source of stress. One recommendation they make is to make digital tools a seamless part of physicians' workflow, including by ensuring different systems can speak to each other. CFPC, that is College of Family Physicians of Canada data, corroborates these findings in family physicians. So knowing all this, how do we support physicians in an increasingly digital world? Well, I come back to the point about supporting physicians in their use of digital tools that makes it easy to do the right thing, to excel, tools that are seamless, integrated, and intuitive. Prescribe It is that kind of digital health tool and the perfect complement to virtually delivered care. So this definition of e-prescribing was agreed upon by the CMA and CPHA in 2012, so it's going back almost 10 years. The slide shows a gradual evolution of prescribing from written or scribbled prescriptions to EMR-based and faxed prescriptions to true electronic prescribing. So you may ask, aren't we doing this already? Well, most physicians have left the written prescription behind using an EMR to generate a prescription, and some may be using autofax depending on your province, and you've been hearing this from Dr. Geiger's talk as well. So how is this different? Even using EMR printed prescriptions and fax, prescriptions are still lost and misplaced. We know that fax is an outdated and unreliable technology. Faxes sometimes do not arrive at the intended destination. Faxes are not secure or private. And at the pharmacy end, they still receive an image from the fax transfer and need to transcribe that prescription into their pharmacy management software system, leaving room for transcription errors. Also, communicating back and forth to the pharmacy team by fax or phone can be time-consuming, logistically challenging, and slow. So true electronic prescribing represents another level of excellence in prescribing. It takes the prescription message from your EMR and sends discrete data, a digital message directly into the pharmacy management software system. So Prescribit really is the modern, digital, secure alternative to the unreliable fax and paper status quo. So this slide shows a more technical overview of the Prescribit service, and I do need to stress that Prescribit is not a new monolithic system that replaces other systems. It's a service that augments existing EMR-based prescribing. So if physicians are already using an EMR to generate and print or fax a prescription now, Prescribit really represents an additional button that says e-sign and send. It integrates with existing EMRs and pharmacy management systems, and it's designed to eventually update information in each province's and drug information system, building on the investments in these foundational systems. So this slide is really intended to illustrate why excellence in e-prescribing matters. So a fundamental aspect of good patient care is communication. Prescribit and e-prescribing more broadly enhance communication within the patient's circle of care. Prescribit modernizes communication to the benefit of the patient and their care team. It is patient-focused and more timely. This is particularly critical at transitions of care. Prescribit enhances legibility and reduces transcription errors. It's safer. Prescribit also streamlines the whole renewal of prescription process. But most importantly, overall, it improves a highly chaotic status quo that I live every day, a hybrid situation in which prescription information is exchanged as faxes or phone calls and does not easily become part of the patient record. The process is an inefficient game of fax and phone tag involving busy fax machines, busy phone lines, and busy people. So communication often takes place through intermediaries, for example, clinic front desk staff, leading to the risk of broken telephone, miscommunication, and possibly serious error. So this slide shows one instance of Prescribit's modern clinical communications or secure messaging tool, which allows physicians and pharmacists to communicate back and forth in the context of the patient record from their EMR or pharmacy management software system. The prescriber receives the message in their inbox, and the patient and prescription information are automatically included. Attachments can also be included and viewed by the prescriber. All clinical communication records are then stored as part of the patient record and can be retrieved and reviewed at a later date. So just on to the next two slides here. So in the next two slides, we can see that Prescribit had started out with very basic features in its earliest iterations, but these continue to evolve and are constantly being refined with direct input from physicians and pharmacists and other clinicians. And on this particular slide, you can see the core features. So you can create a prescription. The prescriber can create a net new prescription. The pharmacist can send a renewal request to the prescriber, and if approved, the prescriber sends back a new prescription. What is currently a messy paper fax process is incrementally being streamlined and improved. Prescription status. So in to me, this is quite a cool feature. The prescriber will be able to see if their prescription has been dispensed or if the dispense has been canceled. The public drug formulary feature, in some jurisdictions, prescribers will have integrated access to public drug formularies to confirm drug coverage in advance of prescribing. The caveat here is that this is highly dependent on the province or the territory. And of course, we touched upon the clinical communications feature, which I think may be a game changer. It's an electronic clinical communication tool that gives you the ability to send and receive secure electronic messages from your EMR or PMS to and from a physician or a pharmacist. On this next slide, we can see upcoming Prescribit enhancements, and I do want to mention that the Prescribit service is continually evolving with direct input from clinicians actually using it to improve the product and the clinician experience. We have been working towards a new version launch that includes a number of improved features and has been guided by principles of improving clinician workflow efficiency and patient safety. So I'll just comment on a couple of features on the slide. You can see there should be much improved ability to handle multiple medications that are dispensed for a single prescription. Also, office staff are being enabled to provide responses to electronic renewal requests and provide responses such as under review or denied as appropriate. More efficient updating of the EMR address book. So this has been an early challenge. But this enhanced feature will provide automatic updates to the EMR when new Prescribit-enabled pharmacies are on board. And forgive me if you've seen this slide already. In this slide, you can see Prescribit's progress across Canada and the growing momentum. The green shaded provinces are live and active with Prescribit users, and there are 13 memoranda of understanding in place with positive conversations continuing from coast to coast to coast. So on these next two slides, you can see that Prescribit really is committed to integrating with EMR and PMS vendors. And here you can see a list of some of the vendors who are either live with the service or committed to going live. As well, the number of pharmacy partners continues to grow in every region. New vendors and new pharmacies are being added regularly. So supporting clinicians in adopting any digital tool requires educational resources and supports. Prescribit has worked with our partner, the AFPC, to create two robust sets of resources that you can see here. So if you have the time and you're thinking about Prescribit in your practice or for a friend or a colleague, consider browsing through these resources. So I know the clock is running down here. To answer the question, why does e-prescribing excellence matter? I will leave you with a few final reflections. First of all, it's 2021 and it's time to axe the facts. Second, Prescribit modernizes the prescribing and dispensing process. It's an EMR integrated tool that supports virtual care and virtual visits. Prescribit also provides enormous potential to enhance communication within the circle of care to the benefit of patients. It can improve patient safety and the patient experience. But finally, overall, Prescribit offers an opportunity to level up in this aspect of our medication management game. We can take our prescribing to the next level towards an ultimate goal of improving patient care. So thanks very much for joining me today, and please feel free to reach out via email or social media. And for the data nerds in the audience, please consider checking out our Infoway Insights data visualization website. Stay safe, everyone.
Thank you so much for that, Dr. Bayat. I do want to ask you, there's so many questions I have, but because of the time constraints, I would like to ask what you would say to a colleague who is a little reticent, a little hesitant perhaps about joining this train. How would you convince them, I suppose?
I would say think about all the, the stresses and hassles of the current state, and how that some of those stresses and hassles and challenges of the current state have been aggravated during the COVID-19 pandemic, as we've been forced to really pivot into this this virtual space and doing everything as virtually as possible. And I would say, test the waters, check out the website. Obviously, talk to colleagues who have used it or who are currently using it. Infoway's website does have a number of interesting articles, blogs, videos from people who are early users, who are current users. So there are quite a few folks, doctors and pharmacists and nurse practitioners now who are starting to use it or who have been using it. So reach out, talk to them, and find out a bit more. See if it will fit your practice. I can almost guarantee that it will. I am so looking forward to getting this going in our practice, and I know it's going to have a big impact on the kind of care we can provide to our patients and the kind of care that we would like to have, that is supported by an improved communication that, as Lynn and Dr. Geiger have also alluded to, hasn't always been there in the current and past state.
We've got some great perspectives today, and I thank you for yours. Lynn gave us that patient perspective, Dr. Geiger with the hospital. It was all fantastic. You roll it up and you just see a light at the end of the tunnel. So I want to thank you for your time in joining us today, Dr. Rashed Bayat there. Well, we've come to the end. I can't believe, as I mentioned, this is the final of the series. If you did miss part of the presentation or your colleagues are asking, the recording for this event will be available by next week. So watch for a wrap-up email in your inbox. And the team at Infoway, I can't push this point enough, really appreciates your feedback. So I will ask you to please complete the evaluation survey. It is at the right side of the main stage. And a big thank you to all of the sponsors for their support in making this series available. Couldn't have done it without their very generous support. So here are the sponsors. And there you go, the list of those important sponsors. I want to thank you all once again for joining us for this final session of the partnership series. I want to thank you for your patience with me. It has certainly been a pleasure and a privilege, and I've learned a lot emceeing this series for you. I hope you can join us once again. Come back for the partnership conference. That is slated for December 1st, so put that in your phones and your calendar. And that program, by the way, will be shared on November 10th. We are going to break a little bit early today. It gives you a chance to check out the industry showcase, the partners really who have made the session possible and complimentary for all attendees. They are available to answer your questions, to talk to you about developments in the industry. So wherever you are, take some time for the showcase. Join us on December 1st. And it's been a great pleasure being with you. Have a great rest of your day.